consultant ENT and head and neck surgery at Manipal Hospital, Dwarka. Today we shall be talking about vertigo. Now, vertigo is not just a disease, it is basically a symptom of a disease. It means spinning of oneself around surroundings or spinning of surroundings around oneself, and can have some uncommon presentations like imbalance, sudden falls, or a sense of being pushed or suddenly thrown out of balance. Now, vertigo can occur because of a plethora of illnesses in the body, because of disorders of the brain, the heart, and the inner ears. But most commonly, more than 90% of all vertigo is peripheral. When we say peripheral, it essentially means disorders of the inner ear or the labyrinth. Our inner ears, along with the organs of hearing, are also the important organs of observing balance. All rotational, acceleration and deceleration movements are subserved by our labyrinths or inner ear. So any disorder of these structures can lead to lack of balance or vertigo. Now, the first and most important thing when one experiences vertigo is where to go. So with that kind of question, if it is acute vertigo, you can simply go to the emergency of any good hospital. You can come to the internal medicine department where they have basic assessment of your symptoms, and then they route you to various specialties depending on your age group profile, other comorbidities like heart disease, diabetes. One of the most common dangerous diseases that one has to rule out, especially in elderly people or old adults when having vertigo, is a stroke or a CVA, something called cerebrovascular accident. But again, let us come back to the ear issues, which account for 90% of all vertigo. Out of that vertigo, more than 90% is caused by something called benign positional vertigo, which is a very common disorder which affects children, adults, and old age people. It is composed of vertigo that most commonly happens when you change position, when you bend down, when you stoop, when you turn sides on the bed, lying down, and getting up from bed. So most commonly it is confused as cervical spondylitis and so on and so forth, but generally it is caused by something called positional vertigo. It is an extremely common disorder, can happen to practically anyone without any cause, and requires a very simple assessment inside the outpatient and a treatment. It is a simple therapy of repositioning. It takes less than 5 minutes sometimes. And the most important part about the fact is that we don't want too many tests rushing to MRIs, a lot of scans is counterproductive. First, one must invest in coming to a concerned hospital, concerned specialty. That could be ENT, that could be neurology, that could be internal medicine, where you have a basic screening. And more often than not, 90% of such vertigo can be turned to the ear. We won't go into subtypes of vertigo or various disorders, but 90% of it is, like I explained, caused by positional vertigo. It is a self-limiting, extremely simple disorder. And the rest of the ones also, something like Meniere's disease, labyrinthitis, can be easily screened out on OPD basis, and the treatment can be started very, very rapidly. So I would suggest that any of you who has been having vertigo acutely or for a long time, start consulting a relevant ENT specialist at the earliest.